years and years, we have used semaglutide for diabetes management. Approximately 2 years ago, we started clinical trials on the medication to determine if it was appropriate to use for obesity management. The answer is yes. So it is the same medication, same chemical compound that we were using for diabetes, but because it delays gastric emptying, it helps control that glycemic index, the big peaks and valleys in blood sugar by regulating insulin and glucagon, as well as working on the glucagon-like peptide 1 receptor in the brain. All of those mechanisms make it a very successful medication for obesity management as well. I think there's a lot of misinformation on semaglutide. 15 or so years ago, these medications that are in the same category as semaglutide came to the market. They were once weekly subcutaneous injectable medications. They have been utilized for diabetes for this time. They've been very successful for diabetes management. We noticed in patients that were diabetic, they were losing weight. They were losing a large amount of weight. So the parent company who made the original Ozempic, Novo Nordisk, they went ahead and did a clinical trial for obesity management specifically, and we now have 2 years worth of data. They are labeling that medication that used to be labeled Ozempic, now Wegovy. It's the same molecular structure, just has a different label. So this is not a new medication. We are just using it in a little different mechanism, but it is the same chemical compound, but we're using it for the FDA approval of obesity management, which it has the appropriate FDA approval. So for diabetes management, patients are kind of in two different categories. We have patients that are what we call type 1 diabetic, where their pancreas no longer secretes insulin. And then we have patients that are usually diagnosed much later in life, type 2 diabetic, and they're patients who their pancreas isn't functioning as well as it should. We don't normally just jump towards a medication like semaglutide, although that is something we could consider. Usually when patients are a type 2 diabetic, we would consider oral hypoglycemics first. You may have heard of medications, generic medications like metformin, or there's a whole slew of other oral hypoglycemics. And then if a patient isn't able to meet their blood sugar control, we may go to a medication like semaglutide.